So, good morning, everyone. Hopefully, everyone had a good Easter yesterday, staying home, isolated by themselves, watching Mass, church, or whatever they were watching by themselves. To our healthcare workers out there, to our first responders, thank you as always. And one group of people I've left out is our CDTA workers that are on the front lines too, every day, getting the essential workers to work, getting people around the Capital District. Thank you to the CTA men and women that are out there every day doing their job. Thank you so much. And to the governor's office and to the state DOH, and especially to our health department, that is doing a great job, led by Dr. Whalen and her team. I can't thank them enough for what they're doing. And to everyone that's out there, and the sheriff running our EOC, thank you so much to everyone what you're doing. Unfortunately, since yesterday, we had two more now county residents that have passed away, both in their 70s, one female, one male. That brings our total up to 14. My heart goes out to the family, my condolences to the family, especially on Easter to lose two loved ones. I can't imagine how much harder it had to be, but again, our hearts and our condolences goes out to the families, and not just to the two, but to the other 12 that this is tragically has happened to. Which gets me to the point that we keep talking about, that why are we social distancing? Why are we staying home in place? Why are we telling people to stay off the street? These are the reasons. And my heart goes out to the 33-year-old Kara Swartz, who died in the town of Bethlehem, a town of Bethlehem residents, who was living in New York City, and to her family and to her classmates and to her friends and the town of Bethlehem. My heart goes out to everyone there too. It shows you that this does not discriminate against age. And I don't know how many times we got to keep stressing that, because these kids nowadays think that I'm not going to have it, I'm not going to get it, it's not going to affect me, because it's only people over 60s or 70s with underlying health conditions. Read the paper, go online. Wake up. I'm not trying to scare you, but in a way I am. We've slowed it down. It has not gone away. We slowed it down because we're staying in place. We're isolating in place. We're keeping non-essential workers home. We're keeping government and things moving forward, but trying to do it in a strategic, smart way. And the only way we can do that is by people taking this serious. It's not going away. We're not going to open up tomorrow. As you can tell, you look at what's going on in Seattle, Washington, they're trying to figure out how to open up. Do they do it quick? Do they do it slow? Do they just, how do they reestablish bringing everyone back in? And they want mandatory testing for everyone, and I commend the governor for this. But it's not available. That's the problem. So please, I can't impress more upon the fact of just staying home. I know it's difficult times. The world around us has changed. But again, if you care about anyone, stay home. Stay home and take this serious, like everyone else is. As of today, we're up 22 from yesterday. We're at 475 positive cases of the coronavirus. The numbers didn't change yet for the 638 people under mandatory quarantine, 74 people under precautionary, and we have 38 people being hospitalized with a hospitalization rate of 8%, and we have 16 adults in the ICU. That's 2 up from yesterday. Also, the testing at Albany is shut down today because of the high winds, so they will not be testing there today. So I just want to make everyone aware of that. If you have an appointment, reschedule your appointment, go through the proper channels, but they will be shut down due to the high winds. So again, please, people, please, you have to isolate. When I drove around yesterday and I was checking on things, and I went down to our Department of Health, and I do want to thank our men and women down there that, been working around the clock, and our DPW, who've been phenomenal, coming out all the time, helping out to check on people. But I do see clusters of people still hanging out, like there's nothing going on, hanging out on the street corner. I want to thank Local 190, Anthony Facina, for letting us, taking the truck out and telling people to social distance and wash your hands. But we're going to be parking that truck in certain areas in downtown now to wake people up. I can't stress it enough. 14 people. How many more do you need? Dr. Whalen?
Thank you, County Executive McCoy. I join County Executive McCoy in expressing condolences to the families who lost loved ones. This is certainly a tragedy. I was asked this weekend if we could give the public some good news. Is there any good news that we have that is coming out of this? And in particular, I was asked, can you talk about people that have recovered from coronavirus? And so over the weekend, I did look at our numbers, and I can tell you that, our total number right now for coronavirus cases is 475. When you're diagnosed with coronavirus, we follow along with you and check on you every day for 2 days or longer if symptoms persist. I can let you know that 216 people have been released so far from that follow-up at Albany County. So out of the 475, we have released 216 people. As we know, the vast majority of people who get coronavirus are along the line of 80% have either a very mild illness or something resembling the seasonal flu, which is not a mild illness, but it is something that most people recover from. The other 20% get a more severe illness. The problem that we have, and the bad news, is that we really don't know who that 20% will be. We know some people with pre-existing conditions and some people, due to their age, have underlying risk factors that may make them predisposed to a bad case of COVID-19. This does not mean if you have pre-existing risk factors or if you are over the age of 60 or even 70 that you cannot recover, because we have seen elderly people recover. Unfortunately, we have also seen younger people have a more severe course, and this morning is an example of a young person who unfortunately died. We don't know how to predict that. And since we don't know how to predict that, still the best way you can protect yourself is to stay at home. I can also tell you, out of the people that we followed through mandatory quarantine, and again, mandatory quarantine means that you have been usually either living with or within 6 feet for a prolonged period of time, contact of someone with COVID-19. We have thus far released 1,235 people from mandatory quarantine. This is good news as well. Unfortunately, we still know that it's a number I can't give you because we don't know, but the vast majority of the population in Albany County is still not immune to COVID-19 and is therefore still susceptible to COVID-19. So while we have these numbers that do demonstrate people that have recovered and people that have gone through quarantine, we still don't have assurances that it is safe for us to resume any kind of life as we knew it before this began. So all of the precautions that we have been talking about still need to be put in place. There's a lot of information in the press about antibody testing. Everybody wants to know about antibody testing. When will it be available? Could I have been one of the people that was asymptomatic and am now immune to COVID-19? This is a very important topic, and this is something that we need to get more information on. There are a myriad of companies that are looking to release antibody testing, and I would urge caution at this point. All of these tests have to be appropriately vetted. We do not want to give people a false sense of security, so we need really to rely on scientific guidance for what the best methods of testing are. The State Health Department is working on issuing guidance on this, and I think that will be very helpful to us going forward. At this point, there is not significant availability of testing to determine antibody status, but this is something that we are going to be actively looking at in the coming weeks and months. In the meantime, it's very important that we have community testing. Community testing gives us the best idea of what our community is currently facing, and it also enables us to use the best methods of control by rapid identification of cases and isolation of cases and quarantine of contacted individuals. We continue to work with the state DOH, and we're hoping later this week to talk about additional test sites so that we can ensure that residents in Albany County who are not able to reach the testing site at SUNY may also get testing. So more to come from that perspective, and we'll continue to follow this along. Thank you.
Thank you, Dr. Whalen. Like I said, government has to continue to operate, and one of which is our Department for Children, Youth, and Family. They have a priority that they have to address in our community day in and day out, and it's the safety of our children. There's children that were mandated through the court systems that we have to check on every day and be there for them, and they have no choice but to go out into the community and do their job, but they do it because they love what they do. They do it because they want to protect the children, and being that April is month of April is our how was I going to say here?
Child abuse
Yes,
prevention.
Children Abuse Month. They have to be out there, and we're trying to get the message out there more. So I do have Moira Manning here, our commissioner, to talk about that. And please, Moira, please tell us more.
Thank you, County Executive McCoy. These are really challenging times for our families. You know, schools being closed, social distancing, and families together 24/7. It can be very stressful. And these high times of stress is really impacting their ability to make sound, smart choices that, you know, they oftentimes aren't thinking before they act. However, during this pandemic, we have seen through the Department for Children, Youth, and Families a decrease in the number of child abuse reports from the State Central Registry. This is very concerning because child abuse does not stop because of COVID-19. The problem really being is that the mandated reporters are not available to see these students. Your teachers, your doctors, and daycare providers are not seeing these children. So what we want to do is ask you as community members, as neighbors, as family members, to take action and protect these children. These are one of our most vulnerable populations, and again, we want to keep eyes on them so that we can maintain safety. And for the parents out there, you know, it's a challenge. You know, now you have an additional burden of needing to teach your children, and you may have multiple children, but it's so important to keep yourself in a low stress level. That includes eating well, exercising, establishing routines. All of those factors can assist in decreasing the levels of stress. We know parenting can be very overwhelming on a good day. So when there's additional stress and burden on a family, it can really create an unsafe situation. So when you're feeling overwhelmed, as long as the children are safe in an activity, please take a break for yourself. You know, take a few minutes, take some deep breaths, and really think before you act. Also, please reach out to us. The Department for Children, Youth, and Families has numerous programs. We have the Healthy Families Home Visiting Program. We have children's mental health, which includes care management as well as outpatient services. We also have early intervention. Please take the opportunity to look at our website and see if there's any services or supports that would benefit your family. You can reach our website at www.albanykids.com. And of course, if you have any questions, please contact our number at 518-447-7324. And in closing, if you do suspect child abuse or neglect, please contact the State Central Registry at 1-800-342-3720. And if you think a child is at imminent danger, please contact 911.
Thank you, Moira Manning. Thank you for the mission that you're doing. And April is National Child Abuse Prevention Month. I guess I should have looked at my notes at the bottom when I was kind of lost it for a second. But we had Pinwheels Garden to raise awareness about preventing child abuse, which we did outside outside the county building. So I can't thank your workers for doing that and staying on top of everything. And it is important. It's so important that we continue to look at the vital services that we have to do in the community and people, if there is an issue, you see an issue, please call. It's there for the parents too. Take a step back, take a deep breath, and things have changed. And if you're having issues at home, being cooped up all day with your children, we're there for you, and we'll help you out. And that's why Albany County Cares, we've done the videos to do different things. And also our mental health department. Again, I can't thank them enough, 7 days a week. 8 a.m. to 8 p.m. And there's the number for you, area code 518-269-6634. And also the 211 from United Way in New York State hotline. And everyone else that's been helping us here do things differently and stepping up in the community. I cannot thank you enough. That's what makes me be proud of being a resident of Albany County, is all the good the businesses, the residents here that really care about the community, and this is where we shine. When things are down and out, this is when we shine the best, and you know, we have to continue to put our best foot forward. So thank you.